Canine coronavirus is a pathogen that contributes to the severity of the canine enteritis complex. Coronavirus was first isolated in 1971 in Germany from military dogs suffering from gastroenteritis. But since then, it has faced the skepticism of many practitioners who claim that coronavirus does not cause much clinical disease. So why, they ask, should they vaccinate for it?
Canine coronavirus, there's been an increased recognition of this worldwide. Netherlands, Japan, Italy, and most recently Australia has reported canine coronavirus. And they're reporting a number of different strain variations. And by that I mean that the virus is modifying itself. Canine coronavirus adapts very well to the environment. It will have a chance to mutate and cause minor variations, which allows it to survive longer in the dog population. And so we're looking at a virus that is adaptable in the environment, is carried by the dog. Basically, that is the only known carrier, although we do have some evidence now that it might be transferred into cats, and that makes it even more important that we should be vaccinating our dog population.
Skeptics or doubters of the potential severity and prevalence of coronavirus should consider the evidence. Coronavirus is a co-conspirator in the canine enteritis complex. In fact, it's become the greatest cause of viral enteritis in dogs next to parvo. The coronavirus infection has been shown to affect up to 26% of family-owned dogs and 30% of kennel dogs. The overall rate of coronavirus infection in dogs with diarrhea was 37%. Those are imposing statistics for a disease that many people think is not significant enough to vaccinate against.
Well, I consider canine coronavirus to be an integral part of that canine enteritis complex, along with canine parvovirus, bacterial infections, and parasitic infections.
It is important to understand the more common and not so common causes of enteric disease. Corona, a component of enteric disease, is often difficult to diagnose.
I think one reason that canine coronavirus has been underdiagnosed, and I've talked about this for a number of years, that we don't have good diagnostic assays for canine coronavirus like we do for canine parvovirus. We have an antigen ELISA test for parvovirus. We do not have one for canine coronavirus at this time yet. I think if we did, the diagnosis of canine coronavirus would be much more reported. We do have electron microscopy, which is not available in all diagnostic laboratories. It's a very expensive test. So therefore, it makes canine coronavirus being underdiagnosed during the clinical phases of the disease in the puppy. And we usually default to canine parvovirus by saying that's what it is.
Canine enteritis complex is indeed a serious, potentially fatal condition caused by the interaction of viral, bacterial, and protozoal agents. The primary culprits are parvo, corona, and giardia. Parvo and corona are the elements of a deadly combination for puppies. A study by the Cornell University College of Veterinary Medicine showed that there was a 90% fatality rate with a dual infection of parvo and corona.
The clinical symptoms are heavily dependent upon maternal antibody. If they do not acquire a lot of maternal antibody from the dam, the severity of these symptoms can be quite bad. Usually anywhere between 5 and 7 weeks of age, the infection can be by itself fatal infection. Of course, if it has these secondary infections like we talked about earlier with bacteria, parvo, then it becomes even more severe. So maternal antibody is most important.
When determining an appropriate vaccination strategy for enteric diseases, many age-related conditions and risk factors need to be considered.
The window of susceptibility for canine coronavirus is much younger than it is for canine parvovirus. After that initial puppy series of vaccinations is given, then depending on the status of whether it's a low-risk or high-risk dog, depends on when you continue your booster. And therefore, you'd get into a situation where you'd increase antibodies, increase protectiveness, and the upside to all this is that you decrease shedding of the virus in the environment.
In a natural environment, Dogs are constantly being infected, experiencing subclinical bouts of enteritis, shedding virus in their feces, and infecting other dogs. These puppies are naturally immune for 5 to 7 weeks because of maternal antibodies. Vaccination plays an important role in preventing viral spread. The virus cannot be eliminated as it is endemic to the population. The main thing clinicians can do is maximize protection by vaccination, environment management, and good nutrition. Unlike parvovirus, coronavirus does not exist very well outside the dog. Therefore, vaccination is essential if the dog has contact with other dogs. Moist, cold weather climates facilitate coronavirus transmission.
I think the seasonality for canine coronavirus, since it is a very labile virus like we talked about, it likes cold weather. So basically you find it late fall, during the wintertime, and early spring. And it's the late fall and early spring where you find your concurrent infections with canine parvovirus, since canine parvovirus is beginning to build up during the springtime, reaches its maximum during the summertime, starts to go down in the fall. So you have these two waves that attack the dog. Your parvovirus during the summertime, coronavirus during the wintertime, and then during the fall and spring you have the overlap or the concurrent infections. And so a veterinarian will see canine coronavirus with parvovirus during the fall and spring, and parvovirus primarily in the summertime.
To manage canine coronavirus effectively, veterinarians need to get back to the basics, which means increasing maternal antibody protection and decreasing shedding. It's important that puppies receive maternal antibody protection in their first couple of weeks of life before they are vaccinated themselves. Vaccines play an important role in enteric protection. Fort Dodge offers the most complete protection against the canine enteritis complex. With the availability of Giardia-Vax, Corona, and Parvo vaccines, only Fort Dodge can provide peace of mind with 1-year duration of immunity on challenge for every fraction. For more information about vaccine protection against canine enteritis complex, contact your Fort Dodge representative.